Hello, it's Dr. Pat with Little Critters, and we have Ramsey, a 15-week-old ferret, with us today. And Ramsey's probably going to be the typical rambunctious slinky you'd expect of a baby. He's in today for a pretty common problem. His owner noticed that he was grinding his teeth, and he's also been losing weight. He's actually quite thin when you palpate him. And he was from one of the big box stores, came with a brother. His brother's gaining weight and doing really well, but this guy's a little thinner than he should be. And the tooth grinding can often be a sign of pain, so we are concerned that something may be causing pain. On physical exam, his abdomen palpates with the colon pretty full. He did poop in the exam room and has foreign material in the poo. The owner is not sure what it is, and we did get some radiographs that shows basically just his whole GI tract full, but no clear obstructive pattern. And so this is a really common issue in ferrets, where they very frequently will get into everything. So they are perpetual toddlers. You have to toddler-proof the entire environment that they're in, because what they see tends to go down the hatch and it can get stuck. They have a little tiny GI tract. And so foreign bodies or things stuck in the GI tract are very common in ferrets, particularly young ferrets. And he is definitely a mischievous young little boy. The other thing we noticed on him, and I don't think he'll sit still to allow us to show it, the back of his tongue is actually bright red and pretty inflamed and down his throat. And we have seen in many ferrets where they'll get into household toxins, bathroom cleaners, and they can get ulcerations and wounds and lesions kind of down the throat and the esophagus, and that could cause pain as well. And then the last thing to think of in a ferret, not as common in these young ones, is they can get Helicobacter ulcers. And Helicobacter is an infectious cause of stomach ulcers in ferrets and can be treated with medicine quite readily. And it is very common in ferrets, so it's something to always consider. And then the last thing, if you have tooth grinding in a ferret, well, two last things. Obviously, it could be dental disease. He has young, healthy teeth. And then it can be a seizure. And so you can get particularly middle-aged or older ferrets that will look like they're grinding their teeth or chattering when they're having a seizure. And those are typically ferrets with insulinomas, which are very common. But on this little guy, he does appear to have been eating some kind of foreign granular substance. It's real small. It does seem to be going through his GI tract, but there's quite a lot of it in there. So we're having the owner do a search through the house to figure out what we've gotten into. And then we're doing some supportive care for him. But the overall prognosis is pretty darn good for this little man.